Welcome back to the morning show here on Arise News. Nigeria is currently facing several concurrent public health emergencies, such as yellow fever, monkeypox, and Lassa fever outbreaks. Joining us now to give us the latest updates on these epidemics and what is being done to end the cycle of disease outbreaks in the country is epidemiologist and member of the National Technical Working Groups on Ebola viral disease, Lassa fever, yellow fever, and infection prevention and control at the Nigeria Center for Disease Control, Biodun Ogunniyi. Good morning.
Good morning.
Thank you so much for joining us. Now, where does one start?
The pleasure is mine.
Let's start with Lassa fever. Yellow fever. Are you with me? Can you hear me?
Yeah, very well.
Yes.
Yeah, very well.
Let's start with the yellow fever outbreak. It really is a matter of great concern right now. Can you tell us what is being done to contain this outbreak, the latest outbreak of yellow fever?
Yellow fever outbreak, like other infectious diseases, has been with us for a while. With infectious diseases, the more you look, the more you find. So the incidence becomes very glaring now because there is greater awareness of the disease. Now, within the last couple of months, we've had recent outbreaks from Bauchi State, from Katsina State, and even before then, we've had it in Ebonyi State and some other states in the country. So far, at the Nigeria Center for Disease Control, we've been able to support the states in containing the outbreak of the disease, and we can say the situation is under control. Primarily, we've been able to deploy rapid response teams to support the states in improving their surveillance and detection capacity for early reporting of the disease. Aside that, we've created more awareness within the community. And also we are doing that in other platforms, both social media, the new media, and the traditional media, to engage the people. We've trained the healthcare workers to increase their index of suspicion of the disease. And we do this across all the affected states, where we prepare other states that are not reporting cases at the moment. And aside that, the stockpile of whatever consumables, treatment support that is required for the patient is being upgraded from time to time. With the support of our partners and with the state. Primarily, we talk more about prevention of the disease among the affected population. But one thing that is critical is that for Lassa fever, for yellow fever, for instance, is a vaccine-preventable disease. And no Nigerian should have yellow fever because the vaccines are safe, they're effective, they're affordable, and they're available in the country. And so one thing we encourage, and we work with our sister agency, the National Primary Healthcare Development Agency, is to vaccinate the population at risk in those affected areas to start with. And in doing this, we've recorded a lot of success in that regard. A good number of population that we've been able to achieve a good coverage for the vaccination exercise in those affected states. Vaccination with yellow fever vaccine is the most effective way to prevent people from getting the disease. And that is what we encourage people to go for from time to time.
Thank you. One of the things that your organization does is mitigating disease and emergencies. I want to talk out to you a little bit about how you work with states to mitigate disease. Yes, can you tell us about how you do that, especially around prevention, or you almost come in once there is an emergency? Tell us at what point do you interact with the affected areas?
So at the Nigeria Center for Disease Control, at the national level, we have the incident command system that works with the emergency operations center that we have established in most of the states in the country. That builds all the coordination structure at the state level. And so with this coordination structure, all stakeholders at the state level are brought together at a platform where we can interface with them. First and foremost, we encourage every state to take up the responsibility of ensuring that their infrastructure support for epidemic response are well built up. and this requires ensuring that they have adequate staff to be able to respond, to detect diseases, to support in the other areas of awareness creation within their communities, within their local government areas, and so on. And so we interface with the state, and when the capacity of the state is not sufficient to handle the outbreak, then we provide additional support from the national. For instance, from time to time, we deploy our rapid response teams that comprises of multi-professional, multi-stake, across disciplines to those affected states, especially with input from other sister ministries and agencies like Ministry of Agriculture, Ministry of Environment, because of what we call the One Earth approach in addressing this problem. From time to time, we've helped the states to provide them with technical guidelines and the necessary tools they need for early reporting. For instance, we've deployed the Surveillance Outbreak and Response Management Analysis system that we call SUMMERS into all the states to ensure that it's early reporting, because prompt reporting will help us to quickly curtail the disease. This has been deployed to the states to help in their reporting. Aside the issue of training them, and aside the issue of ensuring that the information about how to prevent themselves is put in place. Aside encouraging everyone who has a child from 9 months old to go for the vaccines at their health facility, we also emphasize on the need for them to ensure environmental sanitation. Mosquitoes that are causing the yellow fever disease lives in our environment. And as long as there are breeding sites for these mosquitoes in our environment, they will keep multiplying. And when one person is infected with the disease and the mosquito is available, the mosquito keeps picking the virus and transferring it to as many people as available around them. And so we encourage them on how to keep the environment clean and safe from these mosquitoes to breed and affect the people. This is an ongoing exercise, and we require a lot of support of our people to get the result we want.
Thank you. Actually, when you said the word sanitation and environment, it then reminded me of another question I had for you, especially around mitigating diseases. A couple of weeks ago, Nigeria was announced as the open defecation capital of the world. We had been receiving warnings for almost 6 months that this was going to be happening, which means that Nigeria now has overtaken India as the open defecation country of the world. That means that there's issues around sanitation, environment, and that also means that cholera is lurking. As an epidemiologist, how do you start, what do you monitor, what do you approach, what does this mean for Nigeria, and then what diseases are on your radar because of this new horrible #1 position we've just acquired?
Okay. Now, most of the vectors of infectious diseases that we're currently monitoring are being supported by the filthy environment we have around us. And the human factor contributing to this range from the issue of open defecation, indiscriminate dumping of refuse around us, drainages that are blocked and nobody is attending to. All this enables or provides an atmosphere for this, whether it is the vector for yellow fever, which is mosquitoes to breed, or rats for Lassa fever, which we encourage the rats to breed in our environment, or other organisms that are transmitted from hand to mouth in our environment. And so this has been a problem around us that require beyond just one agency of government to handle. It requires intersectoral collaboration for us to be able to curtail this problem. We involve the Ministry of Water Resources, Ministry of Environment, Ministry of Agriculture, and what the World Health Organization described as a One Earth approach to resolving some of this problem, a multi-sectoral collaboration. It is a problem within us, and aside the government's position, private organization, the general public, all of us have a role to play in ensuring we curtail disease outbreaks in our environment. Because a disease outbreak somewhere is a disease outbreak anywhere. And so we want to encourage Nigerians generally for what the government can do, for instance, in the areas of providing vaccines for our people, or developing new vaccines as may be possible, providing necessary technical guidelines, providing necessary trainings, developing awareness materials for our people. On our own level, there are responsibilities we need to take as a citizen. We need to hold ourselves accountable. When you see people around you indiscriminately dumping refugees, just know that they contribute to the disease we're going to have, the next outbreak in our society. When you see people violating the issues around personal hygiene or environmental sanitation, let us hold them accountable, because all these things contribute to how these vectors we breed around us. While the government will keep pushing, we keep providing the necessary support. And at the government level, we have always advocated for increased financial support, for increased budgetary allocation, for public health emergencies, for us to be prepared even before the disease outbreaks come. And this has been our message, this has been our advocacy at the government level and at the institutional level. Even it's a situation that we need all of us to collaborate. For instance, in schools, we expect the teachers to take this responsibility of ensuring that the students wash their hands. When the students are told about this, they can't tell their parents at home on the need to wash their hands regularly with soap and water, which has been proven to protect us from more than 50% of infectious disease transmission. And at the schools level, at religious organizations, this message needs to go around, because we need to hold ourselves accountable and curtail the problem we have in our hands. And I feel this is achievable.
Absolutely.
Yeah.
Apart from the hygiene factor, can we talk about the effect that climate change and deforestation is having with the spread of zoonotic diseases, and the fact that this current outbreak of yellow fever has its epicenter at Yankari Game Reserve is no accident? Can we talk about the link between those two things?
Absolutely. Between 1960 and 2012, population of Nigeria increased from 45.2 million to a whooping 168 million. That is 268% increase in population. And so with increase in population, there is more than 70% of this population live in urban areas. So increased urbanization will lead to increased human activities like deforestation, because these people need a home. With increased deforestation and all other human activities, we are displacing the natural habitat of these vectors, of these, the vectors of these diseases. For instance, we have people now have more animal to human contact as population increases.
Yes,
and with
Mr.
more animal to human contact,
if I may interject here, please hold that thought. We need to take a quick commercial break, and we'll be right back to hear some more from you on this topic. Please stay with us. Welcome back to the morning show here on Arise News. We're still with Biodun Ogunniyi from the Nigeria Center for Disease Control. Mr. Ogunniyi, just before the break, you were highlighting the ways that vectors are moving to urban areas. Please continue.
Thank you. So vectors of these diseases now have better access to human beings because of our increased human activity. And the atmosphere, because of the increased population, because of urbanization, there are a lot of activities of human beings as we continue to have those practices like indiscriminate dumping of refuse, the drainages are blocked, nobody cares for it. We provide the atmosphere for these organisms, for these vectors of the disease to continue to multiply. And so as this continues, we have a major problem in our hand that requires urgent attention of everyone. For instance, if you take yellow fever, the transmission of the disease happens when the virus is picked from monkeys into a human host. Now, how does it happen? Mosquitoes are pick it from the monkeys, and when human beings go into the forest or some other farming activities, the same mosquitoes that pick the virus is able to transmit it into human beings. Such human beings get infected, they come back to the community, and when they get into the community, if these mosquitoes have not been provided an atmosphere to breed in the community, they are able to pick the virus from the infected persons and keep transferring it, and then we have a outbreak in our hands. And so what do we need to do? It is to ensure those interventions that have been suggested, for instance, by the World Health Organization, talking about the global strategy for elimination of yellow fever epidemics in the world. We follow it accurately. And this strategy talks about three things majorly. One, it talks about the need for increased access to vaccination, for increased access to immunization, to ensure that all the people at risk are protected through vaccination. Secondly, it talks about prevention of international spread of this disease. Now, this requires people from who want to travel out of the country to get vaccinated. And let me quickly put a caveat there that possession of a yellow card does not confer vaccination on the people, does not confer immunity on the people. It is not yellow card that confers vaccination or confers immunity. It is the vaccine, because we've seen cases where people obtain the yellow card without getting vaccinated. This is dangerous for our system. And the third point over there is to rapidly contain the outbreak whenever it happens. And how do we contain the outbreaks when it happens? By ensuring there is early reporting. People need not go into self-medication. When they report early, it makes it easier for necessary intervention to be put in place. Surveillance activities need to be improved. We all need to hold ourselves accountable. Infection prevention and control activities. How do you ensure that the environment is clean, is safe for us all, for all of us? Then there is need for increased diagnostic capacity for these viral diseases. In Nigeria, as of 3 years ago, we only have like one laboratory that can test for yellow fever. Today, we have like 6. And even in Abuja here, we have a state-of-the-art national reference laboratory that can test for Lassa fever, test for Ebola, test for monkeypox, test for all this, even yellow fever. Within hours, you get the result. These are the advances we have made on our own side, contributing to this system from the Nigeria Center for Disease Control. And we continue to encourage Nigerians to also help play their own role. The vaccines are available for yellow fever. Let everyone access it in their in their ministries of health in their state, and even in FCT here. Let them access it at every opportunity they have to stay protected, because no Nigerian should be affected by yellow fever, because it's vaccine preventable and it's available. And what other roles do we need to play as individuals? We know that the environment keeps increasing. There is global warming. There are a lot of challenges around us. We need to keep the environment clean and safe, and also ensure the personal hygiene. These are the least we can do as individuals. And we encourage private practitioners through the public-private partnership to see into how they can come into public health space to support what we are doing. We call upon the government at state level to increase their support for public health emergencies, so that we can all collectively take our role at schools, at religious centers, like I said earlier on. Everyone has a role to play, whether in creating, even in the media houses that we are here, like you guys are doing, which is very commendable. Let us have this frequently done. And this will help more people to get the information. At the community level, we are doing ours, also getting to the community, but people can come together at communities, at landlords association, at any level, to keep the environment clean, to hold ourselves accountable. And with this, we can, to a large extent, mitigate some of these problems we have in our hands.
Thank you, Mr. Ogunniyi, and I want to commend you in turn for your work with getting labs in Nigeria, because samples used to have to be sent abroad for testing. And I wanted to ask you, though, about vaccination. As you said, the ideal time, when you can be vaccinated is from when a child is 9 months old and above. But a lot of people will wonder if they have been vaccinated or not. They might not have records. I'm aware that that one yellow fever vaccine is supposed to last a lifetime, but is it possible to now get another one in case you're not sure if you've ever been vaccinated? And is it necessary to get a booster at any point?
So there is no need for a booster dose of yellow fever vaccine if you have been vaccinated before. However, if you are not sure if you have been vaccinated before, there is also no harm in getting a second dose. If you want to be double sure, it's encouraged to get another dose. That does not affect individuals. But to avoid wastages, because there is global shortage of the vaccine across the world, we want to encourage discriminate use of the ones we have at hand. And so if you have taken it before and you have your evidence with you, even if you have lost your card, which is the evidence that you have taken it, provided you have taken it, you can always go back, because the new card-based system now ensure that your records are better kept. So you can always go back and obtain your card to be sure of when you took this. And if you have taken it, you don't need to take it again. It confers a lifelong immunity on the persons who have taken it. And this is what we encourage Nigerians to do from time to time. But above that, aside the issue of vaccination, which is being proven as the most effective way, all other diseases of interest, because the topic is talking about how to contain the outbreaks of diseases, beyond yellow fever, beyond Lassa fever, beyond cholera, all these infectious diseases that are within our radar, the Nigeria Center for Disease Control, for instance, working with other partners, we want Nigerians to help us protect their health better. We have improved our capacity, our capability to prevent, to protect, to detect, and respond and control public health emergencies. But we need the support of Nigerians to play their own role at every opportunity you have to ensure that you are not contributing to how these diseases are spread. If you make your body accessible to mosquitoes, mosquitoes are going to keep replicating on your behalf. And this is going to contribute to a lot of problems for all of us. And that is why we want everybody, whenever you have the opportunity, keep your environment clean. When you visit a facility or you're caring for somebody who is sick, regular hand washing with soap and water is important. Even at our healthcare facilities, we want to encourage all the head of institution of healthcare facilities to institutionalize infection prevention and control programs in their institutions. Because if this is not available, there will likely be the transmission of infection from patients to staff and to other persons who are working in the hospital. This we want to avoid. And this will require a lot of support of all persons who should contribute to this system.
Dr. Ogunniyi, before we wrap up, I just wanted you to just touch on the Ebola outbreak in DRC. When your organization sees an Ebola outbreak in the DRC or in other African countries, what goes into effect? What are some of the levers that get pulled? If you can just give us a brief idea of how Nigeria is protected when we see those type of outbreaks, especially in a place like DRC that's not too far off.
In 2014, we had an Ebola outbreak in Nigeria. We responded to it, and within 2 months, we were able to curtail it. Our systems are better prepared now than it was in 2014. All around the year, we have the National Technical Working Group comprising of experts across all the ministry, departments, and agencies of government, and our partners, the World Health Organization, the Center for Disease Control, and other partners working with us to keep preparedness activities heightened. We have assessed our healthcare, the isolation centers in most of the affected or the international ports of entry where the likely cases may come in. We have instituted efforts to ensure that these health facilities, the isolation centers in those international airport facilities are being assessed for preparedness, and to also train our healthcare providers on the need for high index of suspicion of this case. And we are engaging at the community level through our disease surveillance and notification officers on understanding the case definition. How do you identify a case of a suspected Ebola, for instance, wherever it comes in through, whether through whichever system, how they can easily identify it. And as soon as they identify, they have been provided with a reporting platform that I called earlier on, the surveillance outbreak and reporting response management analysis, SUMMERS, is being deployed that ensure real-time reporting of such suspected case. We have a capacity for detection now in the country that we can, told you earlier on, that we can now detect Ebola even within 8 hours if it enters Nigeria today. And so all these structures are in place to ensure that our people are better protected. And the Nigeria Center for Disease Control is consistently and truly committed to ensuring that the health of Nigerians are protected.
Thank you very much, Mr.
Thank you so much.